When you ask women who are having pelvic floor reconstructive surgery what the thing is that they're most worried about, it's having a catheter. Let's talk about catheters, why we use them, because so many women are scared of coming to see me when they hear that they may need to have a catheter at some point during their journey. I'm Dr. Tenny Brown. I'm a urogynecologist, also known as a reconstructive pelvic surgeon. A catheter is a small tube that we place into the urethra to drain urine out. There are different reasons why someone may need to have a catheter. And we need to know if you're emptying your bladder properly. You may need to have a small catheter placed into the bladder to see how much urine is left over after you pee. Some people, they have a condition that makes it difficult for them to completely empty their bladder. And so they may have to have a catheter either left inside the bladder, or they may have to take a small catheter and they insert it themselves into the urethra to get the urine out, and do that a couple of times a day. The other scenario where you might have a catheter is after surgery. For pelvic floor reconstructive surgeries, about 20 to 25% of people are going to need a catheter right after surgery, but that's temporary, and usually the bladder emptying goes back to normal in a few days. It's still a scary thing. So here are my tips. Talk to your doctor about this concern. For most women, once they have the catheter, they say, okay, I don't want that again, but it wasn't that bad. Also, to reassure you, most of us are using catheters that are so small, and so the discomfort is minimal. We can apply an anesthetic gel to the area around the urethra to help ease the insertion of that catheter. So if this is something that you're very worried about, or it's even stopped you from getting the care that you need for your bladder, it's time to have that conversation. Feel free to share this with your loved ones. And if you've had a catheter and you have some tips for anyone else listening, drop it in the comments.